Thanks for your company this Friday evening. And we start tonight with a special report looking at whether enough is being done to care for the well-being of young people in our region.
A mother in West Cumbria has told ITV Border about her desperate struggle to get help for her daughter after she tried to take her own life. We've learned that many more are facing similar problems. Suicide is the biggest killer of under 35s in the UK. However, 3/4 of young people with a mental health problem aren't getting treatment, and waiting times have soared in the last year. Our reporter Andrew Misra has been investigating the issue. A warning: his report contains details you may find upsetting.
I can no longer live with not knowing if I'm going to find my daughter dead or alive every morning when we wake up.
This is the video Emma shared online after waiting 11 hours in hospital, desperately trying to get help for her suicidal daughter. In Whitehaven, she's letting us in on the experience of what happened next, which Emma could barely believe.
They said, "Have you made any plans?" And she said, "Yes." And they said, "Well, what are they?" So, as a mum, I had to sit and listen to my daughter explain in detail the ways in which she was planning to take her life. And the lady turned around to her and said, "Well, you haven't done it yet." And I just could not believe what I was hearing. Challenging a 15-year-old child who had already tried to take their life was just absolutely shocking.
Crisis teams do have to ask these sorts of difficult questions, but it was the approach towards her daughter that Emma was taken aback by. Struggling to access support through the NHS Children and Adolescent Mental Health Service, more commonly known as CAMS, she says local charities saved them both. Emma tells me she's gone 5 days without sleeping at times, out of fear of what might happen.
What is it like as a parent when you know that your daughter has tried to end her own life?
It is just the most horrific feeling in the world. You feel too scared to walk out of your bedroom in the morning in case you find your child dead. And you're just too scared to shout for them or walk to their room in case you might find that they've tried to take an attempt on their life. It is just, you are living in fear that, your child isn't going to be there anymore.
Emma sharing her experience provoked shock and solidarity from other parents in Cumbria, including local politicians.
The family were failed. There are no two ways about it. The family were failed in that instance. And that we need to ensure that cannot and doesn't happen again.
But Emma soon realised her experience wasn't isolated.
So I think we need some really clear structure.
Forming a small group with other parents to call for action and remove stigma. Some of the messages shared with the group from parents and young people in Cumbria highlight the scale of the problem.
Our daughter's been going through this for 4 years. The help just isn't good enough.
I was told to go home and bake a cake to take my mind off wanting to die. It's just devastating. I feel so hopeless.
COVID's increased the challenges young people face, with classrooms forced to close for extended periods. The Mental Health Trust in Cumbria tell us they've seen a 41% rise in young people being referred in the last 12 months compared to the year before the pandemic. The latest report from the Children's Commissioner, published last month, shows that while 1 in 9 children had a probable mental health condition in 2017, that's now risen to 1 in 6. The Health Secretary is due to publish a review later this year to address this increased need. One solution could lie within the walls of educational institutions.
At this school in Carlisle, pupils from the age of 3 all the way up to 18 have access to a dedicated mental health nurse here on site.
Did you enjoy doing it?
Yeah.
Rosie was appointed here at Austin Friars 18 months ago. She previously worked in CAMS for several years. Her role here includes a range of techniques, including individual and group sessions with pupils like Kate and Megan. It's all done in private.
The students see me as very separate to the teaching staff. They talk to me differently. It means that their barriers are down. They're more likely to share things with me than they are with the teaching staff. There isn't that authoritative, aura about me that the teachers have.
Rosie also helps the staff, who welcome her presence. So do parents, and perhaps most importantly, the pupils.
I like it because it's like private and secret. You're not going to tell the rest of the staff about it. With Rosie, you can like trust that it's just in this room.
Do you think there should be someone like Rosie in every school?
Definitely, yeah, because even if you haven't been diagnosed with anything, we are still teenagers. We still do have friend issues and family issues and things that we're still getting used to as growing individuals.
Those at the top of the school agree, but this is a rare approach. Austin Friars is an independent school with the flexibility and funds to make an appointment like Rosie's. Her job here began towards the start of the pandemic.
During lockdown, reliance on social media to stay in touch and to stay connected was hugely enhanced. And there were benefits, don't get me wrong, but there was very much a downside to that. There was a darker side to it. And I think that we're seeing the impact of that now.
Experts say acting as soon as possible before darker thoughts escalate is crucial.
How much of a difference do you think early intervention can make?
A massive difference. I think I've worked with children for a long time now, and you can see that the quicker that you intervene with any sort of emotional difficulty, the less likely it is to develop. Having early intervention in schools is going to relieve that pressure from our NHS. We're not then faced with a 6 months waiting list, by which point a person's difficulties can be quite increased.
When these difficult subjects.
Andy Airy, who lives near Penrith, believes early intervention in schools could go further. His daughter Sophie took her own life 3 years ago, at the age of 29. Andy and 2 other dads who lost their daughters to suicide walked 300 miles across the country last October, raising more than £800,000 for the suicide prevention charity Papyrus.
This is the thing that's killing more young people than anything else. Not drugs, not terrorism, not road traffic accidents. It's themselves, killing themselves, and nobody's talking about it.
Alongside the other fathers, Andy met the Mental Health Minister last month in London to push for suicide prevention to be put on the national curriculum.
Schools are starting to address some mental health issues, which is great, but we do need to get them to talk about the real sharp end of mental health, which is self-harm and suicide prevention.
Do you think that if it was on the curriculum, it could have made a difference for Sophie?
Well, who knows? But she was never given that chance. Even if it'll save one life, that's a success. But we know for certain, if we got that onto the curriculum and young people were introduced to the idea of suicide prevention in a safe and positive manner, that would save hundreds of lives.
Back in Whitehaven, Emma also believes swift action is needed to avoid dire consequences.
We're going to have a whole generation of children that suffer with mental health issues, that can't function in the way that we need them to function because we're not helping them. You shouldn't have to wait until they've tried to kill themselves before they get any help. It is just absolutely bonkers. You wouldn't leave a child with cancer until it was right at the very, very most extreme. You would treat it as soon as it came up. This kills more people and it needs to be addressed.
A special report by Andrew Misra, who joins us now live in our Carlisle newsroom. Andrew, some really powerful words there from Emma particularly. Has she managed to get the right support now for her and her daughter?
Yes, I'm pleased to say that Emma told me that her daughter is now receiving excellent treatment, but it's getting that care in the first place that can be a real challenge for many people. In 2019, Cumbria, Northumberland, Tyne and Wear NHS Foundation Trust took on the children and adolescent mental health services in the area. That's CAMS that I mentioned in my report. The Trust said that nobody was available to do an interview with us, but in a statement said that it's working to improve every aspect of the services and that it's made some significant investments. Let's just take a look at the waiting times though. Early last year, the average waiting time to access CAMS in Cumbria was 5 weeks. That is less than the national average around that time last year of around 6 weeks. But the average wait in Cumbria has more than doubled since then and is now up to 11 weeks. So you can start to see why accessing these sorts of services is sometimes referred to as a bit of a postcode lottery.
These figures are quite stark, aren't they? And Andrew, on the idea of mental health support in schools that we saw working very successfully, it seems, in your reports, do we know how widely that's been adopted in Cumbria?
Well, I've got hold of some data here which gives us a little bit of an idea. It's from NHS clinical commissioning groups, sometimes known as CCGs. They're in charge of delivering those services to local schools. Now, the group that covers North Cumbria says 46 schools and colleges have access to mental health support teams, which are shared between the schools. The Morecambe Bay group, which covers South Cumbria and also Lancashire, says 33 schools and colleges have this type of help. But the local authority lists more than 400 schools in Cumbria. So it would seem most schools don't have access to this sort of support. Both groups do add, though, that there will be an expansion soon. As for the government, well, the Department for Education told me that extra funding is going to allow 345,000 more young people per year to access mental health support through both the NHS and schools by 2024. I think the big questions for now, though, are how long is it going to be until most of our young people are able to access this sort of early intervention mental health support in schools, which experts are saying is crucial, and what might the impact be on them before then?
Very important questions indeed, aren't they? Andrew Misra, thank you very much indeed.
Well, Cumbrian suicide prevention charity Every Life Matters is witnessing the impact on young people firsthand. Earlier today, I spoke to Vicky Bogan from the organisation. Vicky, thank you for talking to us. I mean, these statistics are pretty stark, and they seem to strongly suggest that there has been a rise in children with mental health conditions. What are you seeing in schools, and how do you think children are coping?
Well, it's really been such a hard couple of years for everyone, especially our young people, and nationally, yes, it has been proven that it has taken its toll on young people and their mental health and well-being. Within schools, I'm seeing many young people just getting on. Some of them may not have been impacted as much as others. They're coping, they seem to be okay. But obviously, there are those that have really, really struggled, and schools are doing their utmost. You know, we've got to remember how hard it's been for schools as well. You know, often firefighting with continual new guidance to follow. So this has meant that the impact has been potentially on those other children who are now just surviving and not necessarily thriving.
It certainly has been difficult for schools, Vicky. I don't think anybody would dispute that. I mean, as a parent, as a carer, a grandparent, you just want your children to be happy and to be healthy. So what can you do if you think your child might be struggling?
Yes, I mean, I think it's really hard. As parents, we all want to fix our children when they're not well. Sadly, there's no sticking plaster for mental health. You know, it's really important to have those conversations if you're feeling brave enough, because it can be scary. So I would suggest that you're really not alone. There are all sorts of different providers out there in the third sector, lots of apps you can look at, but try to be calm, try to have those conversations which are difficult, be present, listen, and don't be afraid to ask for support. Be reassured that you're not on your own. So talk to your young people at home, listen, and then, like I say, ask for help. Don't be afraid to go to the GP. Don't be afraid to use the NHS services. And if you're not happy with the services you're being provided with, challenge it. That's okay. And it's okay not to feel okay, because it is hard as a parent.
That's really good advice, Vicky. I know that will be shoring in itself for people to hear that. Vicky, thank you very much for your time. This is such an important issue, and you can find a lot more on this story, along with important advice and support on mental health and suicide prevention. It is on our website, which is itv.com/border.